So I'm going to hand over now to Dr. Adrian James, so our first rock star lineup. So Adrian, no pressure. But Adrian was elected as president of the Royal College of Psychiatrists in 2020. Adrian holds this role till 2023 and leads RCPsych on behalf of members and associates, but is also a consultant forensic psychiatrist at Langdon Hospital in Dawlish, Devon. And I understand, Adrian, your priorities as president are to establish a pathway to parity for mental health services. Absolutely, yes, thank you. Equality and diversity, another massive thank you. That's a brilliant topic. Sustainability, workforce and well-being. I don't think you could have chosen anything better, to be quite honest, although none of those are easy. So Adrian, can I introduce your good self, and good luck.
Well, thanks very much, Steve, for that introduction, and I'm absolutely delighted to be joining you at Midlands Partnership Foundation Trust. And I wanted to say a big thank you to the organisers. Ilana Crome's already been mentioned. I know that over the 10 years the programme has been operating, that she's been central to it, but also the initiative of Neil Carr in finding the money to set the programme up, and Gul. The great work that you're doing as DME is just amazing. It's a fantastic trust. You're all very lucky to be working for the trust, and I know these have been incredibly challenging times. So thank you to each and every one of you, whether you're a clinician, whether you're a manager, for the leadership that you've shown over the time of the pandemic during these unparalleled challenging times. So next slide, please. So I'm the 47th president after winning the election a couple of years back. It's a 3-year term, so it's if I am a rock star, it's a 3-year world tour, and in fact I've only got a year to go now. It's a voluntary post, and I continue to work as a forensic psychiatrist down in the West Country. I'm speaking to you from my home on Dartmoor, and when I finish this, I'll be cycling into work and seeing my patients. And I think it's really important that I have a proper clinical role, that I can experience the sorts of things that all of you experience, and the realities, the challenges, as well as the joys of working as a frontline clinician. Next slide, please. As Steve has already mentioned, I have 4 priorities as president: parity between mental and physical health, so seeing mental health in the same way that we would see physical health in terms of accessing services, in terms of outcomes and the experience of service users. Championing equality, diversity and inclusion. This is not only the morally the right thing to do, the legally the right thing to do, but if we address these issues, it's good for everybody, and organisations function much better where we address those issues. Workforce well-being is my 3rd priority. We know that if the workforce feel good about what they're doing, if they're nurtured, if they're looked after, they provide a better standard of care for patients. So this is not a selfish thing, this is about patient care as well. And then finally, putting sustainability at the heart of all we do. The NHS is 8.4% of the carbon footprint of the whole of the United Kingdom. So it's right that we address that. But we know that climate change is a direct cause of mental illness. The evidence is growing. So this is a core issue for us, as well as our general global responsibilities. Next slide. So in terms of getting the basics right, next slide. So we do need to invest in mental health, and the buzzwords are the 4 Ps. I'm sure you're aware of that. The Secretary of State did his talk at the Royal College of Physicians. I was there, about the future of health services, and he spoke about performance, personalisation, prevention and people. And we need to, in order to get the performance that we need to invest in our services. And I think it's been quite extraordinary that during the pandemic, we have seen unparalleled, unprecedented numbers of people being seen by mental health services. So while some other services, through no fault of their own, have struggled to keep their operations going, for example, we've actually been doing more work than ever before. And I make this point again and again. And we did get some extra investment in relation to mental health services. We got an extra 500 million, and we produced results as a result of that. But I reminded the Secretary of State only last week that there is another P, there's a fifth P, and he did pick up on it, and that's prevalence. The issue that we're facing is not that our services hadn't been able to function, it's just that because of the pandemic, the prevalence of mental illness has gone up. I think this evidence is now unquestionable. The ONS data has shown that there are higher levels of depression and anxiety. We know that there are more people presenting to all aspects of our services, and extraordinary rise in the number of people presenting with eating disorders. So we submitted plans that we wanted the government to invest. We thought an extra 4.9 billion in recovery funding, 3 billion in capital investment, and 1 billion in day-to-day running. Unfortunately, we got some money, but we still got that battle in order to make sure that we can provide the services that we need, and we need to invest in our capital, in services, and in our workforce. Next slide, please. There has been some good news. We've also done projections on the number of extra psychiatrists that we need in order to deliver the long-term plan. Whilst we didn't get very much extra money, we still do have that money that's coming as part of the long-term plan. And whereas in other branches of medicine, programs have been slashed, we did get a guarantee from Amanda Pritchard that the money that was going in to meet the long-term plan issues, that money would be absolutely safe. And so that's an extra billion year on year going into, for example, core mental health services. And in order to deliver that extra service, we need an extra 815 consultant psychiatrists. We're on our way to achieving them, but we're still about 400 short. And we know that through the college census that we have about 10% vacancy levels. And it's not just about psychiatrists, we work as teams, and we've got an extra 2,000 nurses. There have been reports in the press today about the numbers of nurses, that although we've got more nurses coming in, the demand has just outstripped the supply. Next slide, please. So in relation to recruitment into psychiatry, I think this has been our greatest success. The care that we provide in the future is dependent upon attracting people into all mental health specialties. In our case, obviously psychiatry, and it has been extraordinary. You have all been going out there selling psychiatry as the career the great career that it is, going into schools, talking to foundation doctors, providing a great training experience so that people will be attracted to our specialty. The college has also had the Choose Psychiatry campaign. So recruitment has gone up at core level from 68% to 100% for the last 2 years. And so we've also been able to then argue for more places. So 2 years back, 120 extra places, 140 in the last year, and 240 next year. So there will be many more training places in psychiatry, and I hope that you as a trust are preparing to get those extra training posts, and the next delivery of the 240 will include higher training posts as well. So this is, I think, a cause for great optimism. So again, thank you to all of you who have been involved with this. Next slide. So once we attract people into our great specialty, we need to make sure that we look after them, because if we attract people and that they find they can't perform to the level that they want, or if we lose them, then that's obviously a terrible thing. So we launched the Enjoying Work Collaborative, and this is applying quality improvement methodology, quality improvement science to workforce well-being. And we've got 40 teams across the country that have joined the collaborative. They get a quality improvement coach. They have access to the evidence base around workforce well-being. They form a network themselves so they can learn from each other about what's working. And the early signs from this, we haven't published the full evaluation yet, have shown a huge increase actually in workforce well-being, a huge improvement. And it also seems to have an effect on retention, because clearly if people feel that they're doing a great job, they feel good about the work they're doing, they're more likely to want to stay at that job and to continue in it. So I'm optimistic that this program can spread throughout the whole of the mental health world, but not only the mental health world, across the whole of the world of medicine. I mean, I have lots of people in different branches of medicine, and I think all the challenges that we have, they're the same across the whole of medicine. So we really do need to make sure that we work together to make sure that people can give of their best. Next slide. So next priority is equality, diversity and inclusion. We've done a lot of work as a college in embedding our values into everything that we do. We publish an equality action plan, and there are 29 clear actions. Now, when I started this, we formed a group, a reference group, and we had various roundtables around the key issues. But there was report after report after report that people hadn't acted on. They'd done one or two things and then they'd just gathered dust on the shelf. So we looked at all those reports as well, looked at the learning, and one of the actions for the college was that I and the chief executive are held to account for following through on the actions. So we report to the trustee board year on year. We have to, against each action, say what we've done. I mean, for example, we joined Stonewall's Equality Index. Now, some people think that's quite controversial, but actually it's a very good framework for moving this world forward. So we were pleased that we did that, and in fact we gained the silver award, which was pretty impressive for our first year. But we need to do very much more, and as I said at the beginning, this is an agenda for all of us. If we can get this right, then everybody will be better. And this is about providing services for people from diverse backgrounds that meet their needs, listening to those communities. But it's also about our staff, supporting all staff so that they can get to any position within any organisation that they want to get to. Next slide. So finally, putting sustainability at the heart of all we do, the college published its position statement, Our Planet's Climate and Ecological Emergency. It's got recommendations, pledges for the college. We've said that we will be carbon neutral by 2040, but it's also got recommendations for education, for academia, and for mental health organisations. We went to COP26. I was quite surprised that health wasn't a big issue there. It's a massive estate, really, that the UN takes over. It becomes UN territory, and the World Health Organization had a tiny little stage within the middle of all these huge stages that everybody else had. So one of the things we wanted to do is to make sure that health was brought into the center of talking about climate change, and that mental health was an important part of that. Next slide. So there are opportunities for innovation. I think the pandemic, whilst it's been the most terrible thing for our patients, for our families, and I know many of you will have, this would have been a very personal thing. You may have had COVID, you may have lost somebody dear to you through COVID, and we must never forget, as things get more positive, the devastating and long-lasting effect that it's had on so many people. But it has also been an opportunity to innovate. So next slide. So we've seen quite a significant digital transformation, haven't we? I mean, I'm speaking to you from a bedroom in my house. I always had these devices there on my computer, but really didn't use them. And I think we wasted a lot of time, didn't we, really traveling to meetings for just half an hour and then getting on a train and coming back. And in relation to the care that we provided right at the height of the pandemic, about 80% of services were being provided online. And I know that now there is a debate about the sort of a blended model, that we seeing patients face to face, of course, in our specialty is incredibly important, but many patients report that actually once they've established a rapport and they've had their assessment, that actually meeting online is much better. It's some people find that it's safer, it's more convenient, and in many ways more personal. So there's been a dramatic increase in use of digital technology, but we need to make sure that we address digital literacy, both in terms of staff, but also in terms of patients, and address digital poverty. And it's my view that all patients should have a digital care plan. So we'd see what role does digital have in their care, but what do we need to do in order to support them in terms of hardware, software, training and support. And I commend the NHSX digital playbook, which has got amazing examples of innovation in the mental health space. Next slide. So in terms of integration, integration is central to all that we do. I've already mentioned the extra money that's gone into our core psychiatry, working very closely with primary care to make sure that primary care teams are properly supported to provide care right where the care needs to be provided. We've also done a lot of work on the voluntary and community sector. I work very closely with organisations like Mind and Rethink, and during the pandemic, again, they've often been able to respond very quickly to demand, and we need to make sure that as we move into the world of integrated care systems, that it's not only integration across primary and secondary care, across physical health and mental health, but also that we involve the voluntary sector. And that we make sure that at the time of integration, and that we take the opportunities that will be there in the ICSs to make sure that we can address the physical health of our patients. Next slide. So there's also need for better integration in relation to workforce. We've been doing a lot of work, for example, in supporting physician associates. People who have worked with physician associates have said that they are an incredible addition to the workforce, working alongside psychiatrists and other doctors. We've developed a very particular programme around physician associates in mental health settings, and we want to support them going forward so that they feel properly supported and properly part of our mental health family. The workforce is also important in addressing health inequalities and in terms of climate change, where we need to make sure that people are trained in relation to health inequalities and how to address them, and trained in relation to climate change, and particularly bringing prevention to the centre of all that we do. And the college have funded and now have up and running our public mental health implementation centre, so that we can actually grow the evidence in relation to public mental health, grow the evidence in relation to prevention, make sure that people know what they actually need to do. People often talk about prevention, but they don't actually have the skills to put prevention into practice. And again, I've raised this with the Secretary of State only last week, that there is a huge evidence base around prevention, and this is a cross-governmental issue. We know that much of mental illness is socially determined, and so there's a lot that we can do. If the Secretary of State was to say we can't keep on funding services at a higher and higher level, we have to do something about prevention, and we need to make sure that there's action and not just talk. Next slide. So that's the end of my talk. I'm delighted to be here. You've got another fantastic programme. I've seen all the speakers. I was on the tech test with a whole a rock star array, as has already been said, of people from the world of psychiatry and mental health. So thank you for inviting me. Thanks for all you do, and I wish you all the best of luck with the rest of the conference.